In today's Health Watch, seasonal illnesses are increasing just as we get ready to celebrate the holidays. The CDC reports positive flu tests are up 9% in the most recent week, and cases of whooping cough are 6 times last year's rate. So what does this mean for your holiday gatherings? We've got you covered. Dr. Susannah Hills is an ear, nose, and throat specialist at Columbia University Medical Center and joins us now. Good morning.
Good morning.
So, Dr. Hills, the CDC warns that flu is surging in much of the country. I've gotten my shots. You've gotten yours, Adriana.
I'm going after
Bad
the show.
girl.
I'm going to get
But
my...
it's not too late to get your flu shot.
It is absolutely not. No, the flu season goes through April. So you can absolutely still get your shot and protect yourself from the flu. Go out, do it.
You have seen a lot of RSV in your practice. What is RSV and who is at risk?
Yeah, it's respiratory syncytial virus. I don't expect anyone to know how to pronounce it.
Okay.
But it is one of the viruses I worry about the most, especially since I treat small children. And the inflammation that that virus causes in the airway and in the lungs can really narrow the airway, cause respiratory distress, and it's what brings most of my infectious disease patients in the winter into the hospital. Some of them end up on ventilators, some of them end up with breathing tubes.
So it's not just children.
Elderly can also be very susceptible.
Gotcha.
So older people, yes, and there's a vaccine now for the elderly. So that's available for folks over 75.
Okay.
At-risk folks over 60 can get it.
And pregnant women can get
Yes,
it, right? Because I remember I got RSV when I was pregnant, too, because you're at
okay.
risk.
36 to 38 weeks of pregnancy.
So, Dr.
Yep.
Hills, how are we supposed to gather with family and friends with all of these viruses going around? What do you recommend? Do we have to go back to masks or not quite yet?
Yeah, so really it's sort of common sense guidelines that we've given for all viruses apply this year as well. Keep yourself healthy by washing your hands. Avoid contact if you can with others who are sick, or limit that. If you're sick yourself, then just be aware of protecting those around you. And also be particularly cautious if you're at risk, if you have immunodeficiency, if you're at risk for being particularly susceptible if you do get sick.
So we haven't mentioned COVID, and I know people may not want to hear this, but it is still out there. Are you worried about winter infections?
Every year since COVID started, we're concerned about COVID. We do expect the peak to kind of hit after the holidays. So cases are starting to rise. They'll continue to rise to the end of the month. And we'll see that late December, early January peak probably. So yes, something to still think about, absolutely.
We also wanted to ask you about new data showing the weight loss drug Zepbound can also help with sleep apnea. You are ear, nose, and throat specialist. Who might benefit from this?
Yes, so folks with sleep apnea that's either moderate or severe, who have also a diagnosis of obesity, will potentially get a benefit from Zepbound. And the reason is Zepbound can help decrease your weight. It can decrease the obstruction in the back of your throat from fatty deposits that cause sleep apnea.
All right, Dr. Susannah Hills, thank you so much for joining us. We appreciate you.